And, of course, it's a Tuesday morning, and that means time to talk to the doc as we welcome our guest every Tuesday, Dr. Tim McKnight from Trinity Hospital, Twin City. Good morning, sir.
Good morning, Steve.
How are you?
I'm doing great. It's hard not to be happy on a day like today.
Yeah, welcome to autumn.
Yeah, it's beautiful.
It's a gorgeous day. It's going to be a nice week, and we want you to be healthy. I was reading an article, and you as a doctor, I don't know how often you prescribe to your patients an aspirin a day, a low-dose aspirin. I know that for heart, a lot of folks have, it's been proven that is a good way to keep that heart healthy.
Right, that's true.
Well, I was reading, this was in the medical journal, WebMD, and they were talking about low-dose aspirin improving survival odds for patients with certain types of lung cancers. Have you prescribed outside of for heart health low-dose aspirin?
No, typically not. And I actually had a patient ask me this yesterday. And it's really interesting. We used to just say, yeah, baby aspirin can't hurt anybody, but we know that in some people it is kind of risky.
Does it thin your blood? Is that what I mean?
It prevents the blood from clotting. So
okay.
if you have any bleeding tendencies, it can cause problems.
Right.
If you have an ulcer, it can cause problems or other bleeding tendencies. So you have to be careful. There are certain people that are definitely at higher risk to take aspirin.
So the key is a low dose, and it's not to overdo it. You don't just want to start popping aspirin to try to help the situation.
Yeah, some people take it for pain, but its benefits in those at risk for heart disease is it prevents the clot from forming around the ruptured plaque, and it keeps it smaller. But it's interesting because this question is asked frequently, should I take a baby aspirin a day? And actually, the answer to that is determined by whether you're at risk for heart disease. So if your risk for heart disease in the next 10 years is greater than 10%, then some experts, some groups of experts feel that you should take a baby aspirin. Okay. So I had this patient ask me this question. I said, well, what's your risk for heart disease in the next 10 years? So I went to an online calculator. I plugged in name, age, gender, smoking history, hypertension, cholesterol levels, and then it will calculate a number. And in his case, it was 6.9%. So he did not qualify for that recommendation to take a baby aspirin. So it's kind of interesting that we use a calculator.
What's that number you look at for what percent, if you would say yes, you do?
Well,
he was 6.9%.
Yeah, so if it's greater than a 10% risk within the next 10 years, then a baby aspirin would be recommended.
Okay. Good to know. And think about it. When we were kids, way back in the olden days, we had aspirin, and that was pretty much it. Now you've got ibuprofen, acetaminophen. You've got just all these other different versions of pain relief. It's a interesting just to go to the drugstore and or the grocery store and try to pick out a pain reliever. How do you determine what's right for you?
Well, often if you don't have a chance to explain things to your patient, you can have them talk to the pharmacist. But you're right. There's aspirin, there's Tylenol or acetaminophen, and then there's all the non-steroidal anti-inflammatories. There's a lot of those. Most of us could tolerate a couple days of either Tylenol or one of those non-steroidals. But if we're taking it too many for too long, acetaminophen can cause liver damage, and the non-steroidals can cause kidney damage and ulcers and those kind of things. So to take any of these long-term without consulting with your physician is not a good idea.
Interesting. Yeah, so I mean that's the best way to deal with it. If you're confused about that, ask your doctor and see what they suggest.
And the pharmacist is also another good resource also.
True, very true. All right, week 3 of Fit for Life.
Yes,
correct?
Week 3,
and our topic, intentional healing.
Intentional healing.
Let's explain what that umbrella means, intentional healing.
So last week we talked about our mindset, our emotions, thoughts, and behaviors and relationships, and how that all contributes to either disease and sickness or health and wellness. This week we're going to turn around the other direction and talk about how we can heal. And basically the message tonight is looking at the clues that nature gives us. I think nature gives us 3 important clues on how to heal. And if you look at what plants do or what animals do, these healing messages. One is balance or harmony in all things. The other one is an order and a sequence to everything. And the final one is interdependence, being able to, this idea of a community where everyone works together. That happens in our bodies. There's balance in our bodies. There's order and sequence to all the construction and the synthesis in our bodies. There's order and sequence. So these are three important clues. But if you start to look at your own life, the first question is my life out of balance? And for many of us, it is. We have too much stress. We don't get enough sleep. We're not balanced in our diet. Is there an order and sequence to your healing? When you start thinking about all the things that you might want to do to improve your health, there's an order and a sequence that you need to think about. Mm-hmm. Maybe changing your diet right off is not the first step. Maybe it's something else.
And your body has a way of letting you know when things are out of balance. You're gonna know something's amiss, and
right.
That you need to adjust. That's what's so cool about Fit for Life is you kind of put us a little more in tune with what our bodies are telling us and what we're doing, and then how to go about healing.
Right.
And maybe that requires some medication that is going to be prescribed, or maybe it means that you need to, like you say, change your diet, or
right.
get more sleep, or reduce some stress, the stressors that are making you feel this way. So there's a lot of different ways that we find out that we're out of tune.
Right, absolutely. And if some people will take the course and they're ready to change their diet or start exercising, but they're in the middle of a crisis. They're in the middle of a divorce, or they're handling the affairs of elderly parents who are becoming an emotional drain on them, or they're going through some other crisis. Well, that is not the right time to try to change your diet. Those things become a priority that you have to get through.
Right.
So that's what we're talking about.
Okay.
You have to pick your battles. And then finally, the idea that nature teaches us that there's a symbiotic relationship. There's the flower with the nectar and honey, and there's the bee, and both benefit. And it's this community that has to be synergistic, and that's what happens in our cells. So we have to understand that. And sometimes, we think we're just going to push right through this and we're going to make all these behavioral changes, but there's a lot of people around us that can help us. There's coaches, there's mentors, there's role models, and we need to take a step back and look and say, boy, if I would just be around these people, they could help me foster this healing. So that's another message that nature teaches.
Yeah, don't be afraid to ask if you have a question about something that is going on. I mean, sometimes you just can't always solve it on your own. You need somebody to point you in the right direction.
Absolutely.
And whether that be a physical, a mental, or whatever the case may be.
Yeah, you really do have to stop and reflect, and that goes back to what we talked about last week, which is self-awareness. Mm-hmm. But, sometimes we just get caught up in life, and we need somebody to remind us to, hey, let's push the pause button. Let's take a look at what's happening here, and let's see if we can refocus.
Good advice, as always. Week 3 of Fit for Life. And again, a reminder, you didn't get in on the Fit for Life this time around. The next course, the next class will begin right at the beginning of the year. So
First part of January, yes.
You can already call, sign up, ask questions, find out a little bit more about Fit for Life. Guaranteed it's going to be a good program for you. And a reminder, too, that these little chats that we're having here in the morning, we post these on our website. So if you happen to miss something, or you want to tell your friend, I heard the doc talking about this or that, and I thought of you, we remind people those are posted at WBTClive.com. So very helpful to kind of go back to the archives of what we're talking about here in the morning.
Yeah, we appreciate you doing that, Steve. There's a lot of people that I know that would like to hear some of these messages, so this is a way to access that.
Good advice from Dr. Tim McKnight from Trinity Hospital, Twin City, as always. On a Tuesday morning, Talk to the Doc. We'll tackle another topic next week.
I'll be ready for you, Steve.
All
Look
right.
forward to it.
Dr. Tim McKnight from Trinity Hospital, Twin City, joining us on Tuesday mornings for Talk to the Doc right here on Big Hits, WBTC.